Welcome to today's program, and thank you for joining us. I am C. Virginia Fields, moderator and host of the Manhattan Neighborhood Network Health First program that we bring to you, our viewers, to really provide information and create awareness about health issues that impact all of us. And in this environment, continuing of COVID, there are so many issues that we've been talking about and will continue to talk about. Formally, of course, I am the president of the Borough of Manhattan and currently serve as the founder and president of the National Black Leadership Commission on Health. And our mission really is to eliminate health disparities and achieve health equity. And our focus is on 8 health areas that disproportionately impact Black African Americans, specifically hepatitis C, HIV/AIDS, diabetes, cardiovascular disease, prostate cancer, breast cancer, mental health, and sickle cell. And when we look at those areas, African Americans are disproportionately impacted in each one of those areas. And when we look at COVID, because of pre-existing conditions, African Americans continue to have the highest rates of infections or rather acquiring the virus and even dying from COVID-19. So in this month, which is known as Minority Health Month, we are very pleased to talk today and have as our partner Novo Nordisk, where we're going to be talking about obesity and the disproportionate impact affecting Blacks and other communities of color across this country. We know that obesity is a major problem, or people who live with obesity experience lots of different issues. And we want to talk about that today. What does that mean? What does that look like? And how does that affect one's living? And to get us started, we are happy to have 2 dynamic women. First, let me introduce Dr. Sylvia Gunson, who is the, hello Doc, how are you? Thank you so much for joining us. And she is a double board certified obesity specialist, healthy lifestyle champion, and she is CEO of Embrace You Weight and Wellness, which is an innovative, sustainable, wellness-based weight program that specializes in empowering women to stop obesity over the scale, obsessing, I would say, over the scale, to get to their healthy weight through self-love and personalized science. Dr. Bollie utilizes her internal medicine training to serve on the COVID-19 front lines as the on-site physician at a facility impacted by COVID-19 in Prince George County, Maryland. Thank you so much for being in. I was just in your county over the Easter weekend because I have family in the area, and after all of us having been vaccinated and gotten our shots, it was just such a relief to be able to visit family that close in over a year. So thank you so much. And our second guest is Keisha Calicut. Now, Keisha is a dynamic educator, advocate, specializing in special education, and a passionate health advocate. She's a founding member of the Obesity Action Coalition's Diversity and Inclusion Task Force. This is a disease experience expert panel member with Novo Nordisk and a member of innumerable professional education organizations. I can't tell you how delighted I am to have both of you, and you come from different backgrounds in addressing this problem. Let me stop saying it's a problem, because Keisha said earlier when we were discussing, it's not suffering, it's not a problem, but it is a concern, and it is a disease that we need to address and talk about so that we can take actions to do something about it in our personal lives, our family, and our community. So to get us started, I'm going to ask you, Dr. talk about, medically speaking, what is obesity? What are the different categories of obesity? And what causes obesity?
Gotcha. Well, thank you so much for having me here today, Miss Virginia. Hi, Keisha. It's great to be here with you all and
It is
talking
wonderful.
to your community. So I think it's important to recognize that obesity was just formally recognized as a disease in 2013. So I love that Keisha said that it's not a problem, right? Because problem makes it seem like it's a personal issue or something, but it is actually a medical condition. And we still have a long way for even doctors, even clinicians, to accept and recognize that this is a disease and a medical condition that needs to be treated. And simply put, obesity is the accumulation of excess body fat, so that it starts to have hormonal, metabolic, and even structural side effects or consequences on your overall health. Not all body fat is bad. Body fat serves a function in helping our hormonal function and keeping us warm and everything. But it's when we get an excess amount of body fat that it goes awry. Things go dysregulate. So, what is that excess level? Honestly, we use population based studies to make an assessment, and right now there needs to be a lot more research and work done, but in general terms we use the BMI, the body mass index, and I'll talk about some of the flaws with that. But for to keep things simple, I will just say for right now, we define obesity as having a body mass index of greater than 30 kilograms per divided by meter square. So basically we take your total body weight and we divide it by your height divided by meter square. There's three classifications based on how much risk your body fat or your BMI puts you at for disease. Because the whole point of this is not to judge how you look, is not to judge who you are, but it's more to figure out from a health perspective, are you at risk, health risk, based on the level of body fat or your total body weight? And so how we do that is when we look at class 1, you're at lower risk, considered lower risk, but still at risk for heart disease, diabetes, many of the things you listed in the beginning. If you're class 2, you're moderate risk, and this is when you have a body mass index of 35 to 39.9. If you're at class 3, this is the highest risk category, and that's when you have a body mass index of greater than 40. And also, some older models will call this severe obesity. And all this is saying, when we look at the BMI, it's a kind of a rough estimate of your total body fat. But as I just alluded to, it only looks at your total body weight. So one of the shortcomings and what we're starting to see is that in certain populations, and especially since we're here with the Black Health organization, we should talk about that, right? So for instance, in Black women, but the BMI will tend to overestimate us as having obesity at a lower rate. So if you don't have any other if you don't have any other obesity or weight related diseases, you don't have hypertension, you don't have diabetes, you don't have high cholesterol, and you're not considered Hispanic, then your BMI cutoff would actually be 32 for some studies suggest for obesity. And that is because, again, when we look at our actual body composition, we tend to have more muscle mass at lower body weights compared to our Caucasian counterparts, where the BMI standardization was made. So I think this is a very important point that we need to continue to talk about, because it's good to have this, general population based BMIs classification as a tool, but when we start to look at the individuals and when we start to look at our communities, knowing where do we need to start making aggressive intervention is so important. And with that, I'll stop speaking because I could speak for this forever.
Very informative, and I'm like sitting on the edge of my chair too.
I know. I'm just like, no, sis, you are saying everything that I have been preaching. Yes.
Oh, thank you. Synergy,
that's
synergy,
why we're going to
synergy.
now move to Sister Keisha as a woman who is living with obesity. And we want to commend you for the work you do moving around the country, teaching, educating, sharing your stories, because in the work that we do at Black Health, I find every day people, especially Black women, who are willing to tell their stories and share what they are living with is so helpful to so many others. So, Keisha, please tell us your story.
Well, thank you. Thank you so much for having me. It is a pleasure to be here. For me, had a relatively normal weight, had the freshman 15 and the marriage weight. My weight problems really began with my pregnancy. There was just some sort of hormonal switch that was triggered, and I gained 75 pounds. And then even after I had my son, like the weight just continued to climb. So all those celebrities are like, oh, the breastfeeding, it gets it off. It just, no, that absolutely was not the case for me. And I got to be, like, I don't like to generally talk numbers, but I got to be almost 350 pounds. And at that weight, it is hard to move physically. My joints hurt. I remember like my ankles hurting and my back hurt. I didn't really have any metabolic effects associated with all of that excess weight, but my body just hurt. And my son was about 2 years old, and like 2-year-olds do, he was just walking around the house, and I go to look for him, and just, where is he? And I go to my window, and it's pushed out, and he's standing on the sidewalk. And I was like, just the sheer panic of like, I got to get to my child. And so I run out of the house and I try to go get him. But no matter how hard I ran, no matter how fast I ran, he kept getting away from me. And it was at that point that it's like, this is really affecting my life. It's affecting the life of my child. This is not just a matter of vanity or anything like that. It is actually affecting my ability to navigate the world. And so at that point, I decided like I have to do something. And for me, I had a surgical intervention. But it's important to note that treatment for obesity, there is a continuum of treatments from counseling to diet and exercise and medications, which we need to get more of, all the way to surgery. It's been really effective for me. I'm an old head in the surgery world. I'm like 11 years out. And I've managed to keep most of my weight off. I'd like to lose 20 pounds, but 20 pounds would only change my dress size. It wouldn't affect my health in a meaningful way. And it's hard for me, and I think you would agree, finding the balance between acceptance and trying to get people to realize that obesity is an issue, and trying to balance those out. And I think that is the hardest thing.
I call it
big and fabulous. And yeah, you are big and you're fabulous and you're wonderful. And this is in no way a reflection of your value. And I like the way you stated that, doctor. It's the categories are just your risk. It's not about anything else. It's not about your value. We're not even talking about weight, actually. We're talking about this is your risk factor, and it goes up and it goes up. So I think it was really wonderful that you framed it in terms like that.
So how do you find, in terms of your own story, and we'll get back to the doctor on this too, how do you find this affecting you in social settings? Do you in some way feel stigmatized?
I did. When you're that big, people are just mean. I remember walking across the parking lot, minding my own business. Oh, there goes the refrigerator right there. Like, wasn't bothering anybody. Wasn't bothering anybody. At the weight that I am now, there's a lot less stigma, and there's a lot more body acceptance for different body types now, which I absolutely love. I don't have to go to Lane Bryant or Torrid or whatever plus size store. They carry all of my sizes. I can wear everything in Target and Walmart. So at this weight, even though I'm not a size 6 or even a 10, the world is much easier to navigate. So I want to impress upon people that weight loss really is about health. It really is about health.
Okay. Well, Doc, can you talk a little about the kinds of problems that can develop from having excess weight and obesity?
Absolutely. But first, I just want to say, Keisha, thanks so much for sharing your story. And I can relate so much because actually my wake up call and what called me into this work was both my family history of obesity. My grandma Sylvia, who I've named after, she died from consequences of obesity. She had diabetes, hypertension, and eventually had a massive stroke, which debilitated her for the rest of her life. So that was my calling into medicine and what inspired me into it. And then when I had my first child, my obesity genes were triggered, and I gained 60 pounds in that pregnancy and kept it on for about 2 years till he was 2 years. And then the wake up call was I just was so drained. I couldn't run after him. I was tired. I didn't have energy. I didn't like how I looked as a mom going out. So and it started to impact my practice as a doctor, even where I didn't feel confident in giving recommendations for obesity care to my patients. And that is what the literature shows, that physicians who are overweight or have obesity are less likely to diagnose and treat it properly. And I certainly have started to live that. So that was what was like my impetus, like, you got to change, you have to start. And you're right, there's so much out there that's so negative about how to do it, like just eat less. And I'm sure we're going to talk, Miss Virginia, about treatment, like eat less, exercise more, you can do this, why are you not doing that? And people are so mean about it, but really it's so much deeper, and there's so many different root causes into it. And so the more I learned about obesity science and saw it's not just about the food on people's plate, it's not just about are they working out, it's also about like what kind of neighborhood do they live in, what's their stress level like, what kind of trauma have they experienced, what's their sleep habits like, so what's their hormonal balance, what kind of disrupted hormonal state, there's so many things. And so I think that it's so important that we as clinicians recognize that, because there are so many health consequences, and the health consequences can be as simple as things Keisha mentioned. And I don't say simple because it is true debility, but like arthritis, so pain on your joints. So I talked about like that excess body fat, that excess body weight is heavy, and to carry it, people tend to have lower back pain, they have hip pain, knee pain, ankle pain, and this impacts your ability to work, your ability to do home chores, all types of things. Also, it can affect your breathing because just a lot of that extra fat is carried in the central abdominal region, carried in your stomach. You can't get good lung volume out. You get shortness of breath. You get respiratory conditions. It can affect your sleep apnea where you can't breathe. And all of this all contribute also to heart disease, to stroke. So all of these things, and then we're not even talking about the metabolic conditions like diabetes, infertility. So all of these things are just so important. There's over 236 diseases that are associated with weight. And so many times we treat the symptoms, right? We treat the diabetes, we treat the hypertension, but we don't get to the core root of it. So I love what you said, Keisha, that it's really not just about weight. It's not just about looking good or fit in a particular size. Because you're right, the body positive movement, there's lots of range of sizes and we are accepting more, but it's about looking, what's your risk for disease? How long do you want to live? How long do you want to be on this earth? What kind
Being
of
fabulous.
life do you want to have?
Being fabulous is what you said,
Yes.
Keisha.
Yeah, how long do you want to be here being fabulous? That's what I have to ask.
Yeah.
So let me
quality over quality.
Just let me shift for a second and ask Keisha further about when you're out talking to groups, is it predominantly Black women or what's the composition of the group? Are there men in your group?
Yes. Really, a lot of my focus has been on like step 3 and step 2 trials for different drugs and getting them to see like I might be someone who's using that drug and to put a face and an actual person at the end of all of this. Like, this is the why. This is why we are doing all of this that we're doing. And I really don't talk to a lot of Black women, and there aren't really a lot of Black women who are doing what I'm doing. And I think that that needs to change.
Absolutely.
No, that definitely has to change. And, I always find on these exciting shows like this, we never have enough time. So we have about...
we don't. We're already there.
We have about 2 minutes left. And they've given me some notes that I just want to highlight a couple of things about obesity. Affects almost 50% of African Americans, has been shown to be the strongest predictor of COVID-19 complications. And I've heard that a lot from doctors in terms of people coming in who are very obese in terms of the complication. And it is associated with the severity of the disease. CDC found that African Americans make up 33% of those who have been hospitalized with COVID-19, despite making up only 13% of the U.S. population. Obesity is an underdiagnosed and undertreated disease, broadly recognized as a disease with wide-ranging treatment options. And I think Dr. Sylvia mentioned this about many physicians often aren't well versed in even diagnosing diabetes, and therefore patients and physicians don't feel comfortable with having the conversation. And I think in your presentations, both of you have highlighted that very well, and that's why I just read from the notes to make sure we got it in the discussion. With 30 seconds left,
I can't believe we're done already.
I know. So, Keisha, any last comments in this 30 seconds?
No, just that obesity is a chronic relapsing disease that needs continual treatment. Even if someone does reach a normal BMI, it doesn't mean that you stop taking the medicine or you stop eating. It is a lifelong, I don't even like journey, because journey implies that there's an end. Like, obesity requires lifelong treatment.
Gotcha. Okay, Doc, Sylvia, any last comment from you?
Yes, I would like to say it's not your fault. It really isn't. And we're here to help you. You owe it to yourself to get in partnership. And it is a partnership with someone who is going to really listen to you and to figure out what is it that's causing your particular obesity, and to look at it in twofold. It's about health and your happiness. And you may be happy in the skin you're in, the weight that you're at now, but really when when it comes down to it, do you also want to be healthy there as well? And we can help marry that and get you to your happy, healthy weight. So don't give up hope. Try, keep trying, and make sure you partner with people who can help you on that journey.
And I think both of you have given us some great insight into how we might be able to do that. And I just want to thank both of you for your comments, Dr. Sylvia Gunson-Bollie, and to Keisha Calicut for all of your advocacy and your education work. And to say that, again, this is Minority Health Month, and you have provided a great deal of information on a very important subject. And I want to thank our partners on this and the work that they do, Novo Nordisk, for their support in making possible this presentation today, along with the Manhattan Neighborhood Network. And my office, again, National Black Leadership Commission on Health, bring these programs to you to better inform you, the viewers, about the important topics that impact all of our health and well-being. And we ask you to share this information with your family and your friends, and especially as it relates to the topic today on obesity. Thank you, my guests. God bless you. Let's continue to do the work, and we look forward to having you join us at another time.
I look forward to it.
And
Me too. Thank you so much.
Manhattan Neighborhood Network. Thank you.
Bye-bye.
Bye, ladies. Thank you so much.